Last week, another hospital in New York City came one step closer to being closed.
Hold on to people, they're slipping away. Hold on to this while it's slipping away.
If Long Island College Hospital does close, it will become, I believe, the 11th hospital here in New York City that closes since 2006.
Abre las puertas de la percepción, usa el poder de tu imaginación. Aunque no puedas mirar hacia el sol, sabes que sigue brillando.
Piensa en las cosas que te hacen sentir, cada segundo vivir o escapar. Este momento y la gente al pasar, sientes por dentro que todo se va.
Every time a hospital closes here in New York City, I can't help but think of my mother. My mother passed away when I was 15 years old. She died of a heart attack. About 2 months before she passed away, my mother had what we believe was a stroke. It either took place on Thanksgiving or the day after Thanksgiving. I remember the day. I remember very little of that day, but I remember she was not feeling well, and we called someone, my older sister, who I believe took my mother to the hospital that day, and my mother got treatment, and her life was extended for a couple more months. And then when she passed away, my two brothers and my sister and I, we were split up, and our family kind of experienced the loss of my mother. It was very upsetting and traumatic. As I said, I think I was 15 years old at the time, and I can't help but think of families coming apart every time I hear about a hospital closing. 2 weeks ago, employees from Interfaith Hospital and Long Island College Hospital and members of the Nurses Union, NYSNA, held a rally outside of Governor Cuomo's office to stop the closing of 2 more hospitals. These healthcare professionals are fighting for your life, and they need your support.
And we get the word out! Get the word out! To all of our supporters! In the community! In the churches! In the union! Out on the streets! And in the hospitals! We're going to win this! And we're going to be back here! We're not going to stop! Until we win! Thank you!
What I have a lot of problem with understanding is how easy it is for politicians to think that that closing a hospital will not have an impact on people's lives. About 15 years after my mother passed away, my older brother passed away. He had a different kind of an illness than my mother. My brother passed away from AIDS. He received care over a period of time of many years. It's a long story, but the passing of my mother and my brother had a big impact on my life. And I keep thinking about how the lives of people who are special to us matter so greatly to each of us, and how the lives of people we love are irreplaceable, and how the loss of the people we love can have such a huge impact on our lives, especially if it happens when we're young. For a while in New York City, I worked at a small boutique law firm located in the West Village, near the meatpacking district. One day, one of my coworkers had a medical emergency, and we had to call 911. Paramedics from St. Vincent's Hospital came to our office, and they were able to save the life of my coworker. The paramedics showed up within minutes, and I saw firsthand the paramedics saved the life of my coworker. I was at my coworker's side when the paramedics revived him. Things like these you begin to appreciate when you see the healthcare system that we have actually work to save the lives of the people who we know and love and have around us. After it came to be that St. Vincent's Hospital was facing the possibility of being closed, I became involved in that effort to save the hospital. And as it came to be, we couldn't save the hospital, and St. Vincent's Hospital closed. My coworker's life, who had been saved by paramedics from St. Vincent's, was lucky. He became ill at a time when there was a St. Vincent's there to save him. And over time, I came to realize that the healthcare system that I thought that we had that worked only works to the extent that there's a hospital nearby close enough to respond and treat the medical emergencies of the people who are in life and death situations. But it's not just having a hospital nearby to respond in a medical emergency to the people who live in that neighborhood. Our healthcare system has to be improved. Hospitals remain vulnerable to the economic realities of a system that reimburses some hospitals at a lesser rate than others. This complex system of reimbursement is unfair.
We need to be aware in Brooklyn of a major threat that is going on by Governor Cuomo. In order to not just close Lynch, but also it can impede on every hospital in Brooklyn. The governor and real estate developers are pushing an experimental for-profit healthcare pilot program. Brooklyn patients are being used as guinea pigs. The real estate developers think our hospital is worth more dead than alive. Let's add more condos, let's live like sardines in a can, and let's not build up the infrastructure that you need to maintain a 300% population increase in Brooklyn. Yeah. They want to shut it down, then let hedge funds and private equity investors experiment with a new for-profit healthcare institution. We saw what that did on Wall Street in our economy.
That's right.
They wrecked it. What are they going to do with our patients?
That's right.
The same thing.
I was under the impression that our healthcare system worked just because you had a hospital nearby that was close enough to respond in a situation where someone was in a medical emergency, similar to what my mother went through when I was a little kid, and to the situation of when my coworker's life was saved by paramedics from St. Vincent's Hospital. But the issue of a healthcare system serving everybody is bigger than just having a hospital nearby. There's a commonality that's shared among all of the hospital closings that are taking place here in New York City. On the first hand, you have the state government right now being led by Governor Andrew Cuomo, who is trying to cut the state budget. And the way he has decided to do that is by making cuts to health care. And I believe that this is his opportunity, this is his way or his method to to window dress, if you will, the state budget so that Governor Cuomo can look good if he does intend to run for president of the United States. And here we have a situation where we have a Democratic governor who's willing to go to these extremes, which is to shut down safety net hospitals across the city in order to make himself look good. And on the second hand, another commonality that's shared by all of these hospital closings must be, on some level, a reckless disregard for the health and safety for people who rely and depend on hospitals during life-saving emergencies. If Governor Cuomo were a true progressive Democrat, it's difficult to understand why he would be so obsessed with closing hospitals if his approach to cutting the state budget results in increasing the risk to public health. If he were a true progressive, he would be fighting for an improved healthcare system, one which would eventually lead us to having a single-payer healthcare system in this state. And until we have a single-payer universal healthcare system here in New York State, it doesn't make sense that Governor Cuomo would be pushing for the closing of so many hospitals here, especially in New York City. This year's flu season was aggravated by the temporary closing of Bellevue Hospital, Coney Island Hospital, the VA Hospital, New York Downtown Hospital, NYU Langone Hospital, and portions of Goldwater Kohler Hospital because of damage sustained as a result of Hurricane Sandy. And now that I'm 40 and I'm dealing with my own health issues, I can't help but think about how the most important thing we have in our lives is our health. And I can't seem to understand how so easily this one thing that's so precious to us, so temporary and so fleeting, can be so unimportant to Governor Cuomo. It took a lot of courage for hospital employees and the nurses union to demonstrate outside of Governor Cuomo's office. I wonder what a demonstration would look like if people who had family members who survived a heart attack or did not survive a heart attack turned out at a demonstration outside of Governor Cuomo's office. I wonder if that would have any impact on the governor's decision to continue to close hospitals here in New York City and across New York State.